Riverbend Awareness Project.
The views and opinions expressed in this podcast episode are solely those of the individuals participating and do not necessarily reflect the views or opinions of Riverbend Media Group or the Riverbend Awareness Project, its affiliates, or its employees. It is important to note that the discussion presented is for informational purposes only and should not be construed as medical advice. Listeners are encouraged to consult with qualified healthcare professionals for any medical concerns or decisions. The Riverbend Awareness Project is a product of Riverbend Media Group.
Welcome to the Riverbend Awareness Project. This month we are focusing on National Migraine Awareness Month, and we're learning all about migraine. And so today we have Stephen Pierce with us, a physician's assistant from Neurology and Sleep Specialist. We're grateful that you've come in. I'm grateful. Sorry, normally we have Jeff. I should say Jeff isn't here today, so my co-host Jeff is out, but I'm grateful. And if you were here, you'd be grateful too that you came and took your time to talk to us about migraine. So.
Glad to be here.
Yeah, it's good. I'm excited. Can you explain, kind of start off, like, what is a migraine and how is it different from like your regular tension, just normal headache?
And that's a great question. I think a lot of people try and separate headaches and what type of headache it is, but in reality, there's so much overlap. And so I like to think about it is all a migraine.
Okay.
And so not all headaches are the same. People have different genetics, different life experiences, and different perceptions of pain. And some people have migraines that are in their neck. They kind of go to their eyes, or sometimes it just kind of always in one spot behind the eyes, or all headaches get better with the right treatment.
Okay. And
it's a migraine. I think all headaches are migraines.
Okay. It's kind of like all rectangles or squares, but it's just a different type of square or rectangle. Okay, that makes sense. Nice. Okay. That helps. Thank you. We kind of I'm going to adjust our next question because it says, when is a headache not a headache, just a headache? But I guess when should, most people get a headache every once in a while from whatever it is. When does it kind of cross over into they've been needing medical attention because it's more of a consistent problem? Like, what are some kind of the signs of, okay, I should go talk to someone about this?
Yeah, so there's an acute or a chronic.
Okay.
Chronic is, yes, I started having headaches when I was a kid, and I've always had, I'm going to use headaches and migraines interchangeably.
Okay, thank you.
Many patients will say, I've been having these headaches or migraines since I was a kid, and they've always been every day or 3 times a week, and that's a chronic pattern. There's an acute situation where I'm having the worst headache of my life. Mm-hmm. That's an emergency. That's something you should go to the emergency department for. You should seek medical attention, and sometimes that's an aneurysm, or that's a big deal. And so we always want to kind of separate, is it an acute headache or is it a chronic headache?
That makes sense. Like the level of pain and how often it kind of happens can kind of be like, okay, this is happening all the time. I should definitely go talk to someone. If it's really, really painful, definitely need to go talk to someone. I wonder too, like if you occasionally get headaches, right? And then you have maybe a headache or migraine or whatever that is slightly different than your normal experience, would that be something that you would be like, okay, that was different? Or is that normal for headaches to kind of just vary?
I think that's a great question. We should seek attention when something changes. And so if frequency or character of the headache changes, reach out to your primary care. You can tell. So headaches can just be a pain in your head. Sometimes it's dizziness. Sometimes associated symptoms include changes in your vision. Sometimes it's a increased sensitivity to light, smells, sound. Other symptoms include just being irritable. A lot of times we have prodrome symptoms that happen hours to days before the head pain starts. And these prodrome symptoms are tiredness, neck pain, sensitivity to sound, dizziness, and these a migraine has a process. It starts with the prodrome, moves to the aura, and then you have the headache, and then you have the postdrome. And oftentimes people who are chronic migraine sufferers are in a cycle, and they are having these types of symptoms all the time. Like, I'm always dizzy, or I'm always having this neck pain, when in reality, there's nothing wrong with their neck. It's a migraine that has an example is if someone has a heart attack and they have arm pain. Well, there's nothing wrong with their arm. It's called referred pain.
Okay.
You can have oftentimes referred pain with migraines that is to your neck, or to have these other kinds of symptoms. Sometimes a migraine can look like a stroke, and that a patient will have facial droop, or slurred speech, or significantly impaired vision. And so that's why when we have these red flag kind of symptoms, we go, okay, let's go to the hospital. Let's get this checked out, because oftentimes they are difficult to differentiate by yourself.
Because it could be one thing, but it could be something else. And it's like, I feel like that was a good analogy with like the heart attack and the other pain, right? The pain or the problem isn't in your arm. It's like the problem is somewhere else in your body, but it's kind of communicating that out to other parts of your body.
Exactly.
In very simple, how my brain is processing that. So that makes sense. Okay. Yeah. I don't know. Was there more? Sorry. Okay, keep going.
It's interesting how with a sprained ankle, the care, and so if you ice it and you elevate it, it's going to help it get better faster. But you're not more likely to get a sprained ankle 5 years down the road because you had a sprained ankle today. With migraines, you actually have a path that's worn deeper. Every migraine you have a, just like it is more cows. You can watch a pasture of cows, and they always walk in the same way. And your brain is the same way, in that you will have similar neurotransmission patterns to the neurons, and they activate different parts of your brain in the same way. And so if you are not treating your migraines, you are
creating like a path.
Creating a path.
Or a habit that it's like, oh, this is what happens when this happens. And then it just keeps.
Exactly.
Okay. That's crazy. So you definitely want to get treatment and diagnosis so that you can you retrain your brain to have a different path?
Absolutely. And that is a combination of lifestyle changes and medicines that we have access to. There's an exciting a new class of medicine that we have access to, the anti-CGRPs, and we didn't have that years ago. And so we can treat people's migraines and give them their life back. That's my favorite part about this job is giving someone their life back. And they can go from, I can't do anything, I can't work, I can't take care of my family because I have these debilitating migraines, and we can help people. And I do every day to get them, and it's a process of trial and error and being patient, but it is possible to get that back.
To retrain the paths to not have a migraine or a headache. That's good. That's awesome. That's hopeful. So thank you. It's funny. So we had we got a hold of the American Migraine Foundation, and there was a lady. We tried to stay local for our podcast, right, to get local people, but we were reaching out, and she responded. And she's not a medical person, but she's has migraine, and then an advocate speaker. And so she was talking about where was I going with that? The trial and error and having patience, right, and being like, keep trying, keep asking questions. Keep, communicating all of the things that are happening so that people can be like, oh, it might be this, because there's lots of different solutions. And like we were talking about, like there used to not be nasal spray, and now that is a thing rather than taking the pill. And so I think it's a good thing to keep in mind, right? Like it's going to be a process, but don't give up, because there is light at the end of the tunnel. There's hope.
Absolutely. We're learning more every day. And it's treatable. It's a treatable condition, and there's overlap in other areas. Sometimes people have migraines because they have untreated, undiagnosed obstructive sleep apnea. And they stop breathing maybe a dozen or 50 times an hour.
Oh, goodness. That's not good.
And their brain is stressed because of the low oxygen levels. Their heart is also stressed. And so I've seen it where patients have significant improvement in their headaches by doing a sleep study, learning whether or not they have sleep apnea. And if they do, we treat them, and they say, you know what, this has helped my headaches. And so that's something also to consider. Oh, something in addition to that.
Nice. Thank you. Sorry. Can you pull the microphone just a tiny bit closer? Okay, thank you. It looks like I can see the sound levels over there, and it's picking up, but I'm like, we'll just give it a little more. So you talked about like the different kind of stages of a migraine, right? Something that I was finding when I was like doing a little bit of research, I didn't do a lot, but enough to, hopefully ask some educated questions, was that there are migraine auras. So can you explain kind of what those are? And is that part of kind of the like the prodrome?
Yes,
thank you, sorry.
Yeah.
The prodrome stage. And then are there other like specific things during those stages that happen, just to kind of help someone who doesn't know or hasn't experienced those migraines before, what is happening and what it's actually like?
Yeah, so the prodrome is followed by the aura, and that's a visual or sensory disturbance that occurs before or during the headache. And so sometimes people have sparkles in their vision, or see wavy lines, or black spots, or have just tunnel vision. I've seen that before.
That's awful.
And so it's a warning. It's not painful, but it's an indicator I'm going to have a headache soon.
Your brain is warning you. But that would still be hard too, right? Because I feel like you said, it's not painful, but it's disrupting what you can see, and your focus, I would imagine, would be, it's helpful to know that something bad is coming, and you should probably take some kind of
prepare for that, whether
medication.
You're driving or whether you're helping someone at work, and you're in a position to where, if you respond quickly, you can actually change the outcome. And so we often treat patients with a daily preventative and a rescue medicine. And so the rescue medicine is, the sooner it's taken, the more effective it is in treating that migraine.
So hopefully you can stop it from going through all the phase of the migraine or headache.
Yes, and it's interesting. We are learning every day, but we still don't know the exact cause of a migraine.
Mm-hmm.
It's complicated. We know that CGRP is involved in this process. We know that there's vasoconstriction in some parts of the brain, vasodilation in others. That's making smaller and making larger the diameter of the blood vessels to allow for increased or decreased blood flow.
Okay.
And
thank you. I was like, wait, medical terms are coming at me.
And so we are still learning the exact cause of a migraine is still to be determined, but with CGRP, we have learned, and you have receptors throughout your body that that the CGRP receptors are throughout your body, and so they have. We could talk about pediatric patients. They're more likely to have abdominal migraines, and
like in your
it's a stomach,
in your
it's a
trunk,
pain.
kind of. Oh, you can have abdominal migraines.
You can have abdominal migraines, and that's more common with males that are boys, male adolescent. So yeah, children that are boys. That's what I meant to say.
Yes, male children.
But then once a child is preteen, the demographics change and women are much more likely to have migraines. It's interesting. Hormones have a lot to do with migraines, and we see the onset of migraines at it can be as early as grade school, but often there's a peak at the onset of menstrual periods for women,
Mm-hmm.
and then the first trimester of pregnancy, but primarily during the second and third trimester, there's less migraines. Menopause, in 2/3 of women that have migraines, 2/3 of them will have a resolution or a significant improvement in their migraines.
Oh wow, that's wild. Just because the shift of hormones.
The fall of estrogen seems to be playing a role in that.
A lot to think about. Was there more that you were?
No, that's
okay. I was like, I didn't want to butt in if you were still talking, because sometimes I do that. I'm like, don't cut people off, Melissa. We talked about that already, kind of. And we talked sort of. I guess we could dive more into that. So we don't necessarily know like causes completely. Like, you know how it functions, right? And what's happening while the migraine or headache is happening. Are there certain triggers that are kind of more common and known that you can like avoid or just kind of be aware of? So yeah.
Absolutely. So there's over 100 genes that have been identified as migraine tendency genes. And so if your parents have migraines, your siblings have migraines, your children have migraines, there's definitely a family trend there. We would expect that. Sometimes a migraine tendency is brought on by a head injury, traumatic brain injury, a concussion, a motor vehicle accident or a football tackle or something like that, you can also see these migraine tendencies be triggered by a hospitalization where someone had a severe infection, high fever, and there's damage that's done to the brain, and an oxic injury where there's a period of time with low oxygen and the brain suffers from that. And sometimes it's not necessarily a big event like a head injury or a hospitalization, but just kind of a lifestyle situation. So we know that headaches are triggered by, and migraines are triggered by sleep deprivation. So not getting enough sleep, not drinking enough water.
I'll take some water right now.
There you go.
Sorry.
Yeah. And if we're not eating well, so it's so easy to skip meals and say, okay, I'm too busy. I'm going to skip lunch. And then all of a sudden, I'm getting a migraine at dinner time. It's often complained about that using a computer screen for too long will cause a migraine. Driving without sunglasses or just being outside without sunglasses will often trigger a migraine. There's other foods that can trigger migraine, such as nuts, citrus, MSG, so monosodium glutamate, that's in fast food. Foods that it's a preservative or a taste enhancer. Sneaky, so that's something to pay attention.
It's hard to, if it's in there, it's a lot. It's in a lot of random things. Yeah.
Nitrates, that's a preservative. Meat like jerky or ham will often have nitrates in it. Chocolate, sweets.
When you listed nuts, oranges, I was like, that was what I had for a snack before. I was like, I had a mandarin orange and almonds.
and you know what? These things are good. There's nothing wrong with citrus, but for migraine patients, maybe that's your trigger. And it's not every migraine patient. It's not the situation for everyone. It really depends.
Makes sense.
So I recommend to patients that they pay attention to it. There's a free app. It's called Migraine Buddy. Okay. And it's a way that you can record your symptoms and how long they lasted. And did you take something? Did it help? How long did it take? And we can often identify, okay, so chocolate is my trigger, whereas for this person, it may be nitrates and nuts or something like that.
So, sorry, that made me think too, like, I don't remember if it's, I'm going to probably say this wrong or remembering it wrong, but like for some people, coffee helps them when they have a headache, and some people it causes headaches, right? Is that a thing that is out there in the world that's
absolutely accurate? So I'd like to recommend less than 100 milligrams of caffeine a day. And in an ideal world, we're not using caffeine because you will definitely get, I shouldn't say, but oftentimes we'll see you get a rebound headache as soon as you stop your daily caffeine use. And so if you're not using caffeine daily, you don't have to worry. But if that's part of your life, coffee, energy drinks are your staple, then you say, okay, well, I'm going to cut back. And instead of having 5 sodas a day, let's just have 1. Or whatever you can do to cut back, I think is very impactful. Tylenol, if taken frequently, will will cause a rebound headache. Excedrin is the same situation. Excedrin is a combination medicine. It has aspirin, it has caffeine in it, and Tylenol. And we see that if that's taken more than 2 or 3 times a week, you're going to have rebound headaches.
So like as soon as it's not in your system, can you explain a little bit more about what a rebound headache is? So is it like as soon as it's not in your system, the headache is going to be like, hello, I'm here again, and you have to take more the next time?
Exactly,
okay.
Yeah. So it may benefit you for, just like the caffeine may benefit you for a few hours or maybe even till the next day.
Mm-hmm.
But as soon as you don't have that in your system, it's back and it's worse.
Oh.
And so you take more, and it's this downward spiral.
Mm-hmm. Yeah. So you got to find something that doesn't lead to rebound headaches. Makes sense. Ooh, sorry. Ooh, that doesn't sound very fun.
It isn't. It isn't fun, but it's so real for so many people. It's interesting to note there are 44% of people have undiagnosed migraines. And there is a annual cost of $23 billion lost in the United States through patients who are suffering from migraines and they are unable to work. And so it impacts the workforce significantly, often. So it is the 3rd most common disease worldwide, is migraine.
What do you think about like why some people don't, or what barriers kind of are there that people have that they might not seek diagnosis, or maybe diagnosis takes a little bit longer, like to get there? What are the kind of barriers that are there that why that many people are living with migraine without any kind of knowledge, well, not knowledge, but like treatment or plan to be better?
I think a lot of people settle and they say that's just how it is. They don't really know that there are other options. And mom has already always suffered from this. I'm going to have to suffer with this too. That's not the case. We of course, can change lives by seeking treatment for migraines. The plan normally includes trying if a patient has more than 3 headaches or migraines a week, we do a daily preventative medicine. Sometimes that's a pill once a day. Sometimes that's a once a month injection. We use a variety of medicines. Sometimes it's a SNRI, or serotonin norepinephrine reuptake inhibitor. We'll use a tricyclic antidepressant like amitriptyline. We'll use topiramate. We can use Qulipta, which is an anti-CGRP. That's a daily pill. And then, like I mentioned, the once-a-month injections, Emgality, I'm dictating now.
You're good. You're good. There's a lot of big worded, or lots of long words, like from the medication names.
Yeah.
But I feel like it's good too, because then it shows there's options, right? Like It's not, there's no one size fits all. You're going to have to figure it out. But you can figure it out, right? If something's not working, we can try something else.
We can try a different class. And I like to see if there's a benefit. So maybe someone's having a hard time sleeping. Well, some of these medicines make you sleepy. So let's help your insomnia and help your migraines at the same time. Or if you have a tremor, maybe we can use this migraine prevention medicine to help you with your tremor. Or maybe if you have chronic pain, there's Cymbalta, which is a chronic pain medicine that's not addictive, that's helpful for migraine prevention. And some of these medicines have been around for a long time and are very affordable and available, while others can be very expensive. And so we always start with the least expensive options, but it doesn't mean that if something's inexpensive that it's not going to be valuable. But we see a lot of benefit from trying these other medicines. And there's the triptans. These are rizatriptan, naratriptan, sumatriptan, amitriptan. These are used for rescue medicines. And then there's the anti-CGRPs, Ubrelvy, Nurtec. These are really helpful too. The nasal sprays have spread. And so I don't know if we really want to go into pharmacology, but
Probably not, but unless you really, really want to. But and I guess, what do you mean by pharmacology? Maybe explain what that is first before.
So,
is that how it treats it?
Yeah, the different nerves and different receptors and neurotransmitters, and we could get out in the weeds, but we'll keep it simple.
That's okay. Sorry. I know, I'm like, wait. But I think it combination too, like you have the medication and then you also can be aware of the triggers, right? Like, how's my sleep? How's my water consumption? Have I been eating regularly? Like, being aware and working with your healthcare provider on a plan, to have a combination of like lifestyle choices and medication, right? Like any treatment plan, you gotta have both those things working together, I feel like, for it to be effective, right? So
and keep following up. If we say, you know what, this didn't work, but I'm gonna keep trying and get in on my follow-up appointment, and we're gonna find something, and we're gonna make it work.
Yeah. Don't give up.
Don't give up.
Sure. Okay. Okay, let me check my list. Sorry, here. We've talked a lot about these things, which is awesome. Like, it's just the conversation has gone, so that's perfect. That's how we like it to go. We talked about that. Are there any other kind of lifestyle? I guess talk about that, right? That lifestyle changes. Or kind of preventative strategies that we haven't talked about already that you would like to touch on? Or
I like to recommend, and I use this myself, a screen protector, like a privacy screen on a computer monitor to filter the light. And so that's just a lot easier when you're in front of a computer all day. And phones, tablets, you can get privacy screens for these, and it really helps cut down on that white light that can be so offensive, or I don't know, offensive, but triggering for migraine patients.
It's good to know, because I feel like, especially in this world today, and not everyone sits in front of a computer all day, right? But a lot of us do. Like, I know I have a desk and I sit at it for most of the day, and I get up, right, and go and talk to people and do things. But a lot of my day is sitting in front of my 2 computer monitors, and then I go home and we watch our show or whatever, and then I'll read my audio or my ebook on my phone. So there's a lot of. I probably have too much screen time. Obviously, I could cut that down, like the leisure part of it, not so much like work, because you have to do what you have to do for being in front of a computer. But that's good to know. Like, think about, I can put something that kind of lessens the impact of the white light. I think that's what you said. Yeah.
Yeah, and wearing sunglasses and things like that are just simple measures. Exercise makes a huge impact on migraines. 30 minutes a day, 3 to 5 times a week, has proven to decrease frequency of headaches. And so some patients say, I get a headache when I exercise. Well, we You don't want to push through that. You want to start really, really small and say, okay, let's just do 5 minutes of aerobic exercise. That can be going up a few flights of stairs, or maybe if we can't start there, maybe we'll start with a stationary bike, or a stair stepper, or something gentle like swimming. But as we start to exercise, our threshold or our limit actually increases. And we're able to tolerate more and more before we get a headache. Once you get a headache, don't push through it.
No.
That is not going to help, and it will just make your migraine worse. But if you kind of ease into this, you will be able to increase your capacity. So sleep is incredibly important, 7 to 8 hours every night. And that's for an adult. For a child, to have 10 hours for them. There are simple things like magnesium, supplement, vitamin D, riboflavin, CoQ10. You can go buy these over the grocery store counter, or you could go online and find a migraine vitamin that will have these on them. And taking this daily can be very beneficial. But it does really come down to, am I hydrated? Am I sleeping well? Am I eating regularly? Your brain requires a lot of nutrition. So feeding your brain is so important and often overlooked. And what are we choosing to feed with? Or feed our brain with? And so is that kind of crackers or just things out of the box, or is it fruits and vegetables, things like that?
I think it's good to have like a good, I feel like that's your foundation, right? Your base level, the sleep, the water, the food, the movement of some kind. And I'm not good at them. Sometimes I'm fine, sometimes I'm great, other times I'm terrible at, a combination of those things. But I think it's like a good base level. And then if you still have headache or migraine, you got to go from there. Like, I don't know, I said that wrong. That I didn't want it to come across as like condescending, but like no, those things, even if you're doing all them,
you can do them before seeing a healthcare provider and see if that helps.
Exactly. Thank you.
And you can. It's a combination. Even if you have a great medicine, are you doing those things to help you be healthy? And if you're not, your medicine can't do it all. And it's definitely a combination or a holistic approach in that we're taking care of ourselves. Meditation, Tai Chi, yoga, these are all helpful, and we have evidence that it is in treating migraines. That are we taking care of ourselves? So.
Thank you. That's what I was trying to convey, and you did that well. So, for somebody who hasn't really ever, obviously most people probably have a minor, probably not chronic headache in their life at some point, right? But for someone who hasn't experienced a chronic or acute migraine or headache, how can we be better at understanding people who are going through an acute episode or have it chronically?
Just be supportive, be proactive, and okay, well, let me get you some food, or let me get you some. If they're nauseous, that's not going to help.
Are you nauseous? Do you need food?
Can I get you some water? Can you sit down? Or do you have a rescue medicine? Or do you? And this is something that every patient who has a rescue, they need to carry it with them. Put it in their car, put it in their desk, put it in their backpack, and then they can have access to it. Because this, like we mentioned before, the sooner you treat your migraine, the more effective your treatment is.
Mm-hmm.
You'll actually have less headaches because of it, or less migraines because of it. I like to think about it as a fire. A campfire is pretty easy to put out, and you just dump some water on it. And you think about a forest fire is impossible in many situations.
It has its own weather after a while.
Absolutely. And a forest fire, you just have to let it burn itself out.
Mm.
And I think about a headache as a campfire. Oh, I just have a little bit of head pain. Well, if left unattended, can grow into a severe migraine situation. And there's those warning signs that we talked about, the aura or the prodrome symptoms. And that's when the campfire is kind of flickering or it's starting to come alive again.
Mm-hmm.
And that's when you need to put it out. And as soon as you put it out, then you're preventing that forest fire or that migraine. So just be very proactive, be very consistent in addressing these minor symptoms before they get out of hand.
And I like the asking too, like, if you know there's someone in your life, that you're a coworker or a friend or family member who has chronic migraine or acute headaches, I feel like you can be like, okay, what can I do to help too? Because they probably will know better, like, this is what I need. Or like you said, being like, okay, do we need the rescue medication? That being aware that it's something that happens, but you can help it not be as bad as it could be. So
yeah, and that's a good point. So just if someone has a mild headache, head pain, then we can say, okay, well, you want some ibuprofen or Aleve, naproxen, sodium is Aleve, and we can see if that helps. That being said, if you always take, if you don't always have to step from over the counter to prescription. You can, if you have a prescription, you should use your prescription.
okay.
But if you don't have a prescription, you can use a Excedrin migraine or a ibuprofen, and that can help your symptoms.
And so you can get to a point where you,
or maybe that's all you need. Is if you just have a headache every once in a while, then maybe that's all you need. Everyone's a little bit different. It kind of depends on where you expect to go. And do you feel like is this an everyday occurrence, or 3 to 5 times a week? Or is this, oh yeah, I get a headache or a head pain once a month, and then you need to go see a healthcare provider if it's mild? Probably not. But if you have been dealing with this for years, it's appropriate.
get help.
Get help.
You don't have to be in pain all the time.
Absolutely.
So, okay. I'm trying to think if there's anything I skipped over accidentally, because we were going with the flow, so I'm like, I don't. We talked about rebound headaches. Are there like stigmas or kind of misconceptions around headaches or migraines that you've encountered? And how do we kind of address those?
Well, I think that many people like to say, oh, I don't have a migraine, I just have a headache. But I have a headache every day. And it's like, well, that's not something you should just ignore. If you have a headache every day, it's something that should be addressed. And I think sometimes we just don't want to think about it or don't want to seek help because it's hard to get an appointment or it's doubtful in their mind that it'll be effective, that they'll be listened to.
So don't let it be like, oh, it's fine. I'll just live with it. Yeah. I think I have one more question, but was there anything else that you wanted to talk about that I didn't ask you about?
I can't think of anything.
Okay, you're good. I just wanted to check. People probably get tired because anyone who listens to podcasts will know that I've asked that question pretty much every episode, but I'm like, if I forgot something that slipped through the cracks, I don't want it to slip through the cracks. I want people to feel like, if they're excited or feel like something is important, I want them to share it. So, my last question, it feels kind of more like a beginning question, but I was like sitting here going, I should have asked them that. So I'm going to ask now. How did you become kind of interested in and passionate about headaches and migraines and like neurology, I guess in general, probably with that path, but you have a lot of knowledge, and when we were talking about it, you seemed like excited to talk and share and spread awareness about it. So how did you get here of wanting to share awareness about migraine and headaches?
You bet. So I have really enjoyed seeing people come back and they'll follow up with me and say, my headaches are gone. And I'm able to fully participate with my family. I'm a better employee. I have my life back, and I love that. It is so fulfilling, and it is possible. We see it all the time, and we just need to be. I just want to help everyone with their migraines. I have friends and family that have trouble with migraines and don't know what to do. And I just get excited about helping people. So, yeah.
Awesome. Well, thank you. Thank you for coming in today and teaching us about migraines and headaches and encouraging people to get help because there is help. So, yeah.
You bet. Absolutely.
Thank you so much. Thank you for listening to the Riverbend Awareness Project. You can find past and current episodes wherever you get podcasts or on the Riverbend Media Group podcast.